cases and reported about 400,000 deaths and also about 1.5 million recovered persons. In Nigeria, the Center for Disease Control and CDC has been given daily reports on rising cases, test and isolation processes and procedures, and deaths recorded in the country. Various efforts have also been made to tackle the pandemic, from the establishment of isolation centers by the federal and state governments, lockdown and ease of lockdown restrictions, and the slow and cautious plan to reopen the nation's economy so that things can go back full swing. Also, the president, in his wisdom, established the Presidential Task Force on COVID-19, headed also by the Secretary to the Government of the Federation in person of Mr. Boss Mustafa, and they've been given daily reports on the situation in the entire country and generally. But all these steps have placed stakeholders and many Nigerians on their toes as to the need to be effective in managing situations like this. The question that also comes to mind in view of this is the pandemic and epidemic preparedness for Nigeria's healthcare personnel, infrastructure, and the entire health architecture of Nigeria. In view of this, that we are looking at the topic, epidemic preparedness in Nigeria post-COVID-19 era, prospects and strategies. So, joining us via telephone, of course, this is to ensure that there's no too much interaction and to guide against having too many persons in the studio at the same time, we have the Minister of Health, Dr. Osagie Ehanire. Sir, thank you for joining us. Okay, we'll establish ties anyway. I'm sure he's listening, so anytime from now, he will join us via telephone. We also have the Chairman, Senate Committee on Primary Health Care, in person of Senator Chukwuka Utazi. So, thank you for joining us. Hello?
Thank you for having me.
Yes, Senator. Okay, it's a pleasure to have you online. Now, also we have a health professional on the line in person of Dr. Mike Adoyi. Dr. Mike Egboh, forgive me for that. Dr. Mike Egboh, good morning, sir.
Yeah, good morning.
Yes, it's a pleasure to have you on the program. Hello, can you hear us? Okay, anyway, we'll get to talk more as the program proceeds. Distinguished lady, distinguished gentlemen, you're welcome to the program. Now, at the appropriate time, we shall open the phone lines so that we can also have Nigerians join us. Yes, also on the line, very importantly, forgive me, sir, I did not forget you. Rather, I was trying to make sure that you're there. You're there. That is the Commissioner for Health, Lagos State Commissioner for Health, in person of Dr. Abayomi. Good morning, sir. Hello? Dr. Abayomi, are you there? Okay. Dr. Abayomi definitely too. I'm sure he's listening and will, anytime from now, we'll establish ties with him so that we can have a smooth program today. Of course, we know why we have Dr. Abayomi on the list of our guests today is because of the experience Lagos State has gathered and the situation of the pandemic in Nigeria, how the role Lagos State government has played in tackling the entire challenge. Now, at the appropriate time, we shall open the phone lines for Nigerians to contribute on the program, but we do implore you to be brief and straight to the point when you get through to us to enable other callers to contribute. The lines to call are 0807 622 6771. The line once again to call to be part of the program today is 0807 622 6771. Now, for short text messages only and WhatsApp, you can reach us on 0815 114 5612. I repeat, 0815 114 5612. For easy understanding, 0815 114 5612. Now, you can also send us emails on frcncurrentaffairs@yahoo.com. Just give us your opinions, make it straight to the point and short. frcncurrentaffairs@yahoo.com. We're also streaming live on www.facebook.com/Radio Nigeria Network, or simply search Radio Nigeria. Once again, to see a live streaming of the program, we have You can join this website www.facebook.com/Radio Nigeria Network or simply Radio Nigeria. And this program will take calls as they come. No preferential treatment is given to any caller. Thanks for being part of the program once again. Now, straight to our guests. So far, we've established ties with Senator Chukwuka Utazi, so I think we should start with you, then we'll move on to Dr. Mike Egboh. Now, Senator. Hello, good morning, Senator, once again.
Hello?
Yes, Senator, can you give us an assessment? Yes. Hello, Senator Utazi. Senator Utazi, can you hear us? Can you hear me, sir?
Yes, I'm hearing you.
Okay, good. Now, can you give us a general assessment, especially from the legislative angle, as to how we can tackle this pandemic in Nigeria? A legislative assessment from the view of the legislature. Can you hear me, sir?
Yeah, you said give you what?
A legislative assessment, an assessment.
Okay.
Yes, on the situation on ground.
For us in the National Assembly, it is our duty to put in place a legal framework to guide the executive arm of government in discharging its responsibilities generally. But in the respect of this pandemic, we've looked into the law and the law of the land and discovered that we have a quarantine act of 1926 that was promulgated immediately during the 1918 Spanish flu. We looked at that legislation and discovered that there are gaps in knowledge, bearing in mind that this is the 21st century. So with this in mind, I decided to propose a bill for an act to repeal the Quarantine Act Cap Q2 LFN 2004 and enact a national health emergency bill 2020 to make provisions for regulating and preventing the introduction into and spread in Nigeria of the dangerous infectious diseases and for other related matters. I brought this bill to the National Assembly for consideration. It went through the first reading, and we are hoping that we are going to do second reading. And in the interim, so many other agencies, why we haven't done second reading is because from the Federal Ministry of Justice, the civil society organizations, the Nigerian Medical Association, and other interested bodies who decided to key into this bill to make their contributions. And we stepped it down to allow all these interventions, bearing in mind that during this period, we are not going to hearing. And in order to do that, we have to make sure that we have the input from everybody. We are using this opportunity to get all the people, all the stakeholders that are involved, the Ministry of Health, the NCDC, and all of them, because we have given them notice of this bill, so that everybody will make it now. If we get all the input, the understanding is that if we're able to get all input of all the people that are interested in this bill, that have one thing or the other to do with it, then when we come for second reading, we will not be having problems that normally that when the National Assembly does the second reading and third reading, we send it to the presidency for assent. The presidency normally will get back to those agencies that the law they bill contains and ask them the input. Okay. It is that at that level that we find it. We find that some bills don't go through again. The president will come back with the information from those people and say that it is assent for so reason. We want to, by this means, what I'm doing presently is to make sure that we don't have such a room because we're having an emergency in our hands.
All right.
We're having a public health emergency, and we're doing everything to make sure that we enact a law that will provide for everything that is expected for the health agencies, especially for the Prime Minister of Health. We know what they will be doing.
All right.
Instead of today we are having one executive order, and the next day we have another one. So we want to provide a legal framework that will guide not just for the present pandemic we have, but for all such emergencies.
Yes, Senator. Okay, Senator, forgive me for interrupting you there. Let's hear from the angle of a professional that is also on the line with us. That is in person of Dr. Mike Egboh. Hello, Dr. Mike. Hello? Hello, Dr. Mike Egboh, are you there?
Yeah.
Okay. Oh, we apologize. Yes, we can hear you. We can hear you.
Okay.
Yes, the question now is, I don't know if you were able to hear what Senator Utazi had to say about the legislative angle. Oh, very good. Now, I want you also to give an input into the contents or the provisions of the bill. I believe you've seen it already. Have you made adequate input into this bill? Is it going to be foolproof so that Nigeria as a nation can react or respond when we have outbreaks of this nature?
Thank you very much. And thank you to the honorable member. I think the first thing is that there should have been consultation from the beginning before the bill went to the House. Secondly, there are several bills in this country. We have the National Health Act. We have several bills in different traffic areas of the federal system that are not being implemented. The National Health Act is 12 years to be passed by the National Assembly. We should deal with the emergency issues that we have. Going forward, I know we can be doing that together. I think the first thing we should do that we consult with all the stakeholders, civil society organizations, the media, and stakeholders. So I think that's why that is not good. And I think for us to make sure that it goes to the effort. It's not that we have a deal that not do the whole work. We are very happy in Nigeria because we neglected health, including the National Assembly. They neglected health. It's not too much in the people. It's because now coronavirus has taken a lot of so everybody is going to the same hospital. So all of this nothing can be. And which is good for us. So I think the way to go, appreciate what the honorable said, but we need to bringing a bill of about 19 point something to independence. I mean, it's not the best thing. Looking forward and looking at what other countries have done, what we have done, get there, and how to do that bill. I think that is the key thing. The implementation, the leadership, the release of funds to make sure that the bill to pass into a law that is implemented. The Health Act was passed about 4 years for money to be released. So I
4 years.
We have to look at the next government system, the leadership system, and the financial system. Those are the kind of things. But the most important thing is consultation. Thank you.
All right, thank you, Dr. Mike. We'll still come back to you to ask a few, to look into other issues. We just want to break the ice now that we are at the introductory stage of today's program. Let's hear from Dr. Abayomi, the Honorable Commissioner for Health, Lagos State. Dr. Abayomi, are you there? Dr. Aki?
Hello.
Oh, good morning.
Hello, I can hardly hear your question though.
Oh, no, yeah, we've not asked yet. We just wanted to establish ties with you and make sure that you're on the line.
Yes, I'm on the line.
Okay, very good. Now, Dr. Abayomi, Lagos State has been in the center of the entire COVID-19 episode, pandemic in Nigeria, from the index case to having the highest number of cases in the state. from the legislative angle and preparedness for the future, can you give us a general plan the state has as we progress in tackling this challenge?
Well, I'm sorry, I can hardly hear you. Can somebody repeat your question so I can hear it?
Oh, I'm really sorry. Dr. Akin we cannot hear us, but let's see if we can. Let's see if our engineers can get to make sure that the lines are clear so that he can, Dr. Akin can hear us, so we'll come back to him.
Can you hear me though?
Yes, we can hear you, so go ahead.
Okay, I'm trying to imagine what your question is based on the previous two speakers.
Yes, go ahead.
So I think you asked how is Lagos coping and in the context of the legislative space around security. So first of all, Lagos still remains the center of the outbreak, and that's for obvious reasons. Lagos is the commercial hub of Nigeria, and therefore sees the most inflow traffic. It's very densely populated, and so it's the perfect environment for multiple importations of a contagion as corona, as it was during Ebola. It's just that Lagos was lucky to have contained Ebola being a contact contagion rather than a droplet or airborne contagion, which Lagos is very vulnerable to. But because of that, and we knew that we were going to face several biosecurity threats and biological threats in the future, and because we know we're vulnerable, Lagos has been preparing for this situation, and we still say that this is going to be one of several events in the future, because that's just the way megacities are evolving, and that's just the way the ecosystem is evolving. So in respect of the outbreak, we have active community transmission at the moment. We're changing our strategy to cope with that. We are implementing an integrated approach to manage patients both at the central isolation facilities and also at the periphery at the community level. Over the past 5 years, we've been doing extensive review of our legislative health laws. We've been developing draft policies on bioeconomy and biosecurity, and we've been carrying out several simulations in Lagos in preparation to see how we would mount a concerted and harmonized response to a biological threat of this nature, whether it's airborne or waterborne. We're also cognizant of multiple global treaties that speak around biological threats. There are many conventions that Nigeria is signatory to. The United Nations Security Council Resolution 1540, the International Health Regulations, the Practices of Veterinary Services, the Biological Weapons Convention, and a host of other global treaties that we are a country and signatory to, and the Global Health Security Agenda. Okay. So these all speak to because time is moving, science is advancing, human footprint is increasing, movement of people and animals is increasing. We're beginning to see a different ecosystem evolution, and the opportunity for both man-made and natural biological threats is increasing. And the opportunity for scientists to either scientifically or deliberately alter organisms in a way that can pose threats to a community is exponentially increasing. So we've taken cognizance of all this and we've reviewed our laws. We have draft policies and guidelines which has put us in a position to recognize that it's very vulnerable and therefore it needs to take a very proactive start.
Okay.
We're also working with I know that the the West African Health Authority is developing a regional biosecurity roadmap, which it has developed certain levels of drafts, which it plans to share with each of the government states of the COAS. They've developed a very detailed questionnaire which has been circulated to all ministries of health across the 14 member states of ECOWAS. And that questionnaire was to assess the preparedness of each state in the advent of a biological threat of this nature. WHO has been warning against this kind of event. Several organizations have been asking that low to middle income countries would be heavily devastated by such an event, and that we should put health systems strengthening structures in place and spend more money on health sector and research and development.
All right,
so these are all the assets, the attributes of a biosecurity roadmap. So we're in an outbreak right now. It is a very clear lesson to all of us. We have to take this space very seriously. We have to move with the times. We have to mitigate against our vulnerability. We have to put certain systems in place to increase our resilience against this kind of threat, which has the capacity to not only cause a high level of morbidity and mortality, but as you can see, threatens to collapse economies and bring down the livelihoods of our people.
All right, thank you, Doctor.
The biosecurity unstable environment is a very dangerous thing for us to experience as a community.
All right, thanks.
So I totally welcome this move in terms of looking at the laws, putting a legal framework in place. We've done a bit of that already in Lagos because we recognize our extreme vulnerability, and we're very happy to move forward with this kind of initiative. But most of our energy at the moment is diverted towards bringing COVID-19 under control in the epicenter, which still remains Lagos by virtue of its demographic profile.
All right. Thank you very much. Thank you very much, Doctor. Let's come back to you now, Dr. Mike. I'll still come to you, Senator Utazi, so that you can give us a sneak peek into the provisions of the bill you talked about earlier. But let me hear from Dr. Mike Egboh. Dr. Mike, are you there? No, Dr. Mike, can you hear us?
I can hear you.
Okay. Yeah. Now, Dr. Mike, you heard the analysis on strategies to preparedness, yes, to ensure that the country is prepared for the future in case things like this come up again. But now, can you tell us, what do you think about the efforts made by a state like Lagos, considering its population, considering its economic, the economic role it plays in Nigeria? How would you look at the performance of Lagos? Has it been, can you say it's up to expectation?
I would say yes, because they managed to isolate together against the people, and that area I think is the Nigerians work with the community, they do the right thing, and you know what is like the area of people work and so getting people to read law, getting people to listen is one major thing. So I think and I will try to gone well in Lagos, and that's why the local mapping was done to ensure that the local reality is to make sure that people who govern everything we are involved in it. Because when you experience then they are you know what I think we need to in Nigeria going forward we need to learn from our lessons. What have we learned? The Ebola case in Lagos now different countries have come and Lagos is always the first one. So that Lagos is the first point. I think that we should be okay in the future what do we do? How do we prepare personnel? How do we prepare community? How do we learn from the lessons that we've done? What protocols do we put into place? What systems do we put in place? So these are the things. How do we mobilize the community? Persons in Lagos are very important. How do we engage them? How do we engage the area boys?
Yes, we know.
Governance
Because when people to attack, the one is almost no. Because like this is better.
Not be crisis. Maybe this the commissioner to travel to Lagos and find out how to so we can be prepared. That's what we call preparedness. It has not been from state very high. Go and find out how it was done. I remember that when in China when it was happening, and so that preparedness to come back to be ready and we did a good job. So I think we need to look at it interface relationship and lessons learned, best practices, and forget about our pride. So I would say, yes, we my lessons and let us be doing well. I will give them today. But one thing I need to say is clarification of roles.
Of rules.
The role of federal government is what is the role of Lagos State? What is the role of local government? And for most of the time, they neglect civil society. Most of the time, they neglect the private sector. The federal government, the state government cannot do it alone without the private sector. Right? So it must be holistic and it must be sectoral approach. Thank you.
All right, thank you, Dr. Egboh. If you're just joining us, the program is Radio Link coming to you live on the network service of Radio Nigeria. Today we've been discussing with an array of guests who are joining us via telephone. We have Senator Chukwuka Utazi, who is the Chairman, Senate Committee on Primary Health Care. We also have so far the Honorable Commissioner for Health, Lagos State, in person of Dr. Abayomi, and Dr. Mike Egboh, a health expert. At this time, we'll be going for a short break. When we come back, we'll establish ties with the Minister of Health to also give an input into today's program. Stay with us. We'll be right back.
Radio Nigeria, uplifting the people and uniting the nation.
If you are elderly, here's how you can take care during the pandemic. You can take care by avoiding exposure, staying at home, washing your hands with soap under running water, or using alcohol-based hand sanitizer. Take care by avoiding touching your face, eating nutritious food, exercising regularly, and staying connected with your friends and family. Take care by being prepared, keeping a supply of your essential medicines close to you. If you must go out, Mama and Papa, please ensure that you use a face mask. If it is a cloth face mask, ensure that you wash it when you get back home with soap under running water. Sun dry and iron before you use that face mask again. Papa, wear a face mask today. Protect me and I'll protect you. This message was brought to you by the Coalition of Societies for the Right of Older Persons in Nigeria.
Honorable Minister, can you hear me, sir?
With the National Orientation
Okay.
Agency.
We're on a break, but we'll come to you immediately after the break, sir. I know in another 1 minute we will be back. Yes, sir. Very soon. Thank you.
So Daniel, don't forget this is you would have to tell them.
Make it your responsibility. Stop the spread of coronavirus. Keep a distance of at least 2 meters between you and others.
Hello, okay, Senate, we are coming back now. We're on a break. We'll be back. Yes, if you're just joining us, the program is Radio Link, coming to you live on the network service of Radio Nigeria. And today we're looking at Nigeria's preparedness for the post-COVID-19 era and also for future occurrences that could be similar to an outbreak, emergencies particularly. And we've been speaking with our guests, an array of guests who joined us via phone lines. We have Dr. Abayomi, who is the Honorable Commissioner for Health, Lagos State. Also, Dr. Mike Egboh, a health expert, and Senator Chukwuka Utazi, Chairman Senate Committee that has to do with health. Anyway, and we just joining us is the Minister of Health, the Honorable Minister of Health, Dr. Osagie Ehanire. Sir, you're welcome on the program.
Thank you.
Now, Dr. Osagie, already we've talked about the legislative angle in preparing for epidemics or pandemics like we have presently. Now, we'd just like to know from your angle as Minister in charge of health in Nigeria, what are your expectations of this bill? What will change when it comes to pass? I don't know if you've studied the content, but what should we expect?
There's a slight problem with the audio. It started up very well, but it's not too good now.
Oh, I apologize for that.
Can you hear me?
Yes, I can hear you. We can hear you.
Yeah, your audio was at the beginning, but it's fading.
Oh, we apologize for that. But if you can hear me, even if you can hear not hear me too well, we are asking that the senator just talked about legislation that will handle issues like this, pandemics like this, in the future. We just want to ask, do you have an input, and what should we expect? What should Nigerians expect when it passes? Hello, Honorable Minister.
Yeah, are you sure you're speaking into the microphone? I can't get it.
Of course, definitely, sir. Okay, maybe we'll get back to you, Honorable Minister. But if you can hear us, we're looking at the. Go ahead, Honorable Minister, if you can hear us. I'm sure you have an idea of what we'll say.
Okay, go ahead. Now, what?
Okay, good. Okay. Now we're asking that earlier, Senator Utazi from the Senate talked about a bill that will handle issues like this in the future, the COVID-19 pandemic. We're now asking you, as the Minister of Health, what do you think will change when such a bill comes to pass, when it becomes law?
Well, we have not spoken in depth with the distinguished senator yet. The bill is still being scrutinized by the legal department of our ministry. Those who are sponsoring the bill will definitely be having a meeting with the Ministry of Health officials, including the
Okay. Hello, Honorable Minister.
Yeah.
Okay. Now, can you give us a situation report? Where are we presently in Nigeria as regards COVID-19?
Hello, sir. Well, we apologize for that. But we're just asking, what is the situation presently in our country as regards COVID-19? All right. Thank you, Minister. Senator Utazi, are you there? Okay, good. Well, back to you now. Senator Utazi, can you give us, now, after the COVID-19 pandemic, by the grace of God, the world is going to find a solution to this challenge. Things, analysts, experts have said that the way things are done throughout the globe will change. Does this bill capture, or is it realistic in this bill on how things will be now in our country? Hello? Hello? Did you? Okay, can you hear us now?
Just repeat your question, please.
Sir? Hello? Hello, Senator?
Yes, I'm speaking your question.
Okay, good.
Repeat your question, please.
Okay, yes, I was saying that after experts have said that after the COVID-19 era, things will change. The way we eat, the way we talk, the way we go to work and do general human activities will change. Is this captured in this bill? How realistic is it?
Well, thank you. Of course, post COVID-19, we are going to have we relate socially with other people. A lot of funny numbers are going to emerge, follow as a consequence of this pandemic. It will take a long time for Nigeria to return to what we used to be. Today, everybody is scared of each other, no matter how healthy the person looks, no matter where the person is coming from, whether it's lonely place or happy place. Everybody is conscious that anybody can be a carrier. So it will take time for us to return to normalcy. If you borrow from experience of what happened in the past, in 1918, within Spanish flu.
Spanish flu, yes.
It took 2 years, 1980 to 1920, for that flu to expire, and then Nigerians and the world return to normalcy. So with this one, with the pandemic we are having presently, after 102 years, we don't know how long this one is going to last. Is it going to last is it going to end with this year? Are we carrying it into 2021? So is the longevity of this ailment will determine to a large extent how we are going to behave, and the protocols or the health protocols we are going to have will be dependent on that. So, but all I know is that if you look at what happened with Ebola too, hand washing and all that came and became a way of life. And then hand sanitizers in front of every building and all that. A bucket of water, the running taps. We move with that for some time. Now we've returned back to it again. After that Ebola, everybody went this way, and we returned and continued our life without bothering whether anywhere you go, first of all, wash your hands, or the hand sanitizer will be refilled so that people will just come and press it and get liquid and cleanse their hands. So with after this one, I hope Nigeria will not return after this exercise. We just say, okay, and forget about our hygienic approach to life. I will expect that Nigerians will at all times carry a bottle of sanitizer in the pocket. It doesn't matter. It doesn't matter that the public will come and go, and then we say we won't practice our hygiene again. We won't be washing our hands regularly as we are washing presently. It's good for ourselves, not just only for the pandemic, but for all other ailments as well. We know that most of the problems we have, most of these diseases we contract is as a result of what we touch, what we do with our hands, and how we take care of our health. So all these things should become in our life, not just because of our pandemic. We will continue being hygienic at all times so that it's safe, because it's always better that prevention is always better than cure.
All right. Thank you, Senator. Let's now hear from Nigerians. Nigerians are inching to speak to our guests and to also be part of the program. The lines to call, or the line to call rather, is 0807 622 6771. Once again, the line to call to contribute on the program is 0807 622 6771. Don't forget, you can also reach us on. Okay, we have a caller already. Hello.
Good morning.
Yes, good morning.
I'm not hearing you. I don't know if you're talking to us.
Oh, no. We're hearing from callers now.
From Akinola in Egboh State.
Okay, go ahead, please.
Thank you very much. I greet you.
Yes, we're answering. Go ahead, please.
Now, I think the minister mentioned something which I'm happy about. That after the COVID-19 era, that Nigerians must have learned that hygiene is very, very important. That this idea of washing hands regularly is nice for Nigerians. Then apart from that, with Nigerians, especially our politicians, must have known that there is a need to develop our health sector. That those of us that have been clamoring that this medical tourism should be abolished, that there is wisdom in it. That we should make sure that our health systems are put in proper perspective. Then our educational system should also be put in proper perspective. Like this idea of students, 100 students in a classroom. You go to some of our universities, you see hundreds of students, some of them by the windows, receiving lectures. All these things, solutions should be sought to them. There should be spacing in all our schools. I think by the time we do these two, we will be able to contain that COVID-19. Thank you. God bless all of you.
Thank you very much, Bishop Isong. Yes. Hello, good morning. Hello, good morning. Tell us who you are and your location, please.
Good morning.
Yes, good morning.
Yeah. My name is Chief Jude Umaja.
Good morning, Chief.
I come from Duchess of Imo State.
Yes, please go ahead.
Can I go ahead?
Go ahead, please. Fire on.
I want to enjoin the federal government to begin now to increase the budget for the health sector, to to bring it up to the standards stipulated by who? African Union and others to improve our health sector that is substandard according to the chairman of the Presidential Task Force on COVID-19, Boss Mustafa. I mean, while also setting up a social intervention fund for health, where within Nigerian philanthropists and others can donate into, together with creating a special ministry for epidemiological matters out of the present Ministry of Health, who should use this fund to encourage research into the use of herbs and plants by our universities, research institutes, and others to produce vaccines and drugs to fight emerging world diseases like COVID-19, especially during their subsequent outbreak to prevent their rising to epidemiological proportion. I advocate for the posting of at least one sanitary inspector and a nutritionist into each of the primary health care centers in the country, who should actually educate rural dwellers mainly on how to live good hygienic lifestyles, eat adequate diet to build enough immune system.
All right,
to
thank
fight
you, Chief Jude.
world diseases like COVID-19 and others that may.
All right, thank you, Chief Jude. Let's take more calls now, then we'll go back to our guest. Hello?
Hello.
Yes.
Good morning.
Yes, good morning. Please go ahead.
Yes, I'm Chukwuka.
Okay.
I'm calling from my hometown, Umeko Warenkwoji in Imo State. Nigeria has
Hello? Hello, Chief Charles.
ranging from natural food crops, herbs. Yes, I'm hearing you.
Yes, go ahead, please.
Yes, Nigeria has what it takes, ranging from natural food crops, herbs, shrubs, and trees that could be harnessed by our pharmacists in collaboration with alternative to orthodox medical practitioners, dietitians, and nutritionists into tablets, caplets, and capsules as balanced diet and food supplements to provide natural immunity that could fight such diseases as COVID-19 that has no drugs to cure. Thank you and God bless you.
Thank you very much, Chief Charles Obioha. Hello, good morning. Tell us who you are. I think we'll take this one more call, then we'll go back to our guest. Your name and location.
Hello.
Yes, good morning. Your name and where you're calling from, please.
Okay, my name is Fiase Motur Nofa. I'm calling from Benue.
Oh, okay. Fiase Motur. Please go ahead.
Thank you. Good morning to your esteemed guests who are calling the same way talking to you.
Yes, I think
I want to appreciate the Presidential Task Force, the chairman, who has shown capacity to handle issues. One man I admire so much. I want to say that now we are looking at the way forward because we must not remain where we are now, even with the COVID-19 that is ravaging the whole world, and then Nigeria is also inclusive. I want to look at an area where the government needs to give so much attention. The area of technical education. We have talked so much about health. We have seen that the health sector actually was not giving us what we wanted, but now the government has given so much attention, and then we can see that things will change by its face. I want to talk about the technical education. If it is now evident that we cannot practice e-learning as it is right now, and it's so embarrassing because if technical education was taken seriously and the use of a computer was introduced at the early stage of this world of children, by now we would have been able to handle the issue of some states giving lectures online, and they would have been able to take care of that. It is so embarrassing that most of the teachers cannot be able to handle computers. We cannot operate them because they have been more of the theoretical aspect than the practical.
Okay.
It is really embarrassing.
What?
So hello sir.
Yes, please.
You wanted to say something?
Yes, I was going to say that. Can you give us a solution in just 30 seconds? What do you think should be done at this stage?
The solution is that as it is now, curriculum planners should go back and think of how ICT will be embedded. I mean, it will be embedded with so much practicals and not theory, so that in case we have something more than this, we can be able to handle it. Most of the students, they cannot keep to what they taught them in school, and it is so embarrassing. Thank you so much, Laini.
Thank you very much, Fiase Mutu. for joining us. Okay, let's now go back to our guest. Let me start with the minister. Hello. Honorable Minister, are you there?
Yes, I wish you could fill up the volume. I'm struggling to hear you.
Oh, okay. We really do apologize for that. Our engineers are working tirelessly behind the scene to ensure things flow better. But did you hear our callers?
I barely heard them. I heard one man talk about technical education.
Yes, that was the last caller. He also talked about leveraging on
very well, but I didn't hear you.
Very clearly. Okay, I see. You can just give us a reaction to some of the issues that were raised since you heard most of the callers, sir.
Well, most of the comments go around improving the health sector, which we agree with absolutely, because the need is very glaring right now. But you must remember that this is a public health issue, and most health systems in the world were not ready for what happened. If you look at television, you see what happened in various, even well-developed countries like the United States, Italy, UK, Japan, China. The sheer volume of patients and people who got sick from so high that many systems just collapsed under the sheer weight of the volume of patients. So what we are trying to do in Nigeria is to manage the outbreak in such a way that we're able to have, first of all, multiple treatment centers, multiple response centers, and also do everything we can to have what we call this targeted approach. I think but there is no doubt that all countries that face carrier reform, how to improve and prepare more in a more granular way for these outbreaks of this nature. The public health, of course, is almost different from the medical health, the personal and individual health that the medical service that is rendered to you as a person. Because the individual health also in Nigeria needs to be reformed. With our primary healthcare, secondary healthcare, tertiary healthcare, and specialty hospitals, which need to be rebuilt, revamped, and the administrative structure altered, and as well as the financing structure. So that's one side. But the public health in itself also needs to be reviewed and the strategies checked and balanced against the expected disease outbreaks. So yes, I do agree. Most countries in the world have suffered embarrassing collapse in their health systems in responding to COVID-19. Nigeria is still trying to cope, and we are preparing for the worst and also striving to get the very best we can.
All right. Thank you, Honorable Minister. If you're just joining us, once again, the program is Radio Link, coming to you live on the network service of Radio Nigeria. And our guest today so far has been joining us via our phone lines. Now, when we come back, we'll take more calls. Don't forget the line to call 0807-622-6771. We'd like to remind our guests to please stay with us and not disconnect from the phone lines. This is just a short break, and we'll join you back. Thank you.
Radio Nigeria, uplifting the people and uniting the nation.
Hey, Mama Ngozi, now here you dey, Madam Atama. Now waiting, you no here for this yard at Gaga dey cough for some time now. Wetin that one call me? Gaga don't get corona. Landlord must pursue and come out from this yard today before you finish us.
Haba, Madam Atama. Say person dey cough no mean say you don't get coronavirus. Corona cough no be like ordinary cough. The symptom na serious cough, fever, and if person no dey fit breathe well.
Oh, you mean say person go get cough, fever, and he no dey fit breathe well?
Yes, but the person go do test to confirm whether he get am or not. And even if he get am, e no mean say na death sen ten ce, because many people wey don get am don survive am.
Na fear o, make me think say you don get am.
Na the problem wey we get now. Many bad tori and talk about coronavirus wey don dey cause plenty confusion. Make we no dey spoil matter for this coronavirus. Instead, make we come together to stop the spread of coronavirus.
This message now from National Orientation Agency with support from UNICEF.
Hey,
Hey, my friend, longest time. Keep your distance. Are we quarreling? Haven't you heard that coronavirus has entered Nigeria and people are contracting the virus every day? But I use hand sanitizer to clean my hand. I can't contract it. That's a good step, but it's not enough. No handshakes, no hugging. Practice physical distancing by simply increasing the space between you and other people to prevent the spread of coronavirus. Truth is, stay at home. I'm only out because I came to buy food items for emergency.
You have to take responsibility to prevent the spread of coronavirus. Avoid areas where there are lots of people. Ensure to keep a physical distance of at least 2 meters from other people. Wash your hands with soap and running water regularly and do not touch your face, eyes and mouth if you have not washed your hands.
Take responsibility for you and the rest of us.
This message is from the Federal Ministry of Health, the Nigeria Center for Disease Control, and its partners.
If you are elderly, here's how you can take care during the pandemic. You can take care by avoiding exposure, staying at home, washing your hands with soap under running water, or using alcohol-based hand sanitizer. Take care by avoiding touching your face, eating nutritious food, exercising regularly, and staying connected with your friends and family. Take care by being prepared, keeping a supply of your essential medicines close to you. If you must go out, Mama and Papa, please ensure that you use a face mask. If it is a cloth face mask, ensure that you wash it when you get back home with soap under running water. Sun dry and iron before you use that face mask again. Mama, Papa, wear a face mask today. Protect me and I'll protect you. This message was brought to you by the Coalition of Societies for the Right of Older Persons in Nigeria, COSRAPPing, in collaboration with the National Orientation Agency, NOA.
Radio Nigeria, uplifting the people and uniting the nation.
Yes, the program is Radio Link, as you've heard, coming to you live on the network service of Radio Nigeria. And this morning we're looking at epidemic preparedness in Nigeria post-COVID-19 era, prospects and strategies. And we have on the line an array of guests. We have the Minister of Health, Honorable Minister of Health, in person of Dr. Osagie Ehanire. We have Dr. Mike Egboh, all the way from the United States. We also have, speaking with us, Senator Chukwuka Utazi from the Senate. And of course, we have Dr. Abayomi, like we said earlier, the Honorable Commissioner for Health, Lagos State. Yes, Dr. Abayomi, thank you for holding on. We're coming to you now. Hello, Dr. Aki. Hello, Doctor. Hello, is it?
Yes, I'm here.
Okay, good.
I can hear it.
Very good. Now, Dr. Akin, you heard our callers, so many, most of them are centering on the health sector in Nigeria. We know Lagos State is a state that has a very strong economic hold on Nigeria. How do you think we can check medical tourism in our country? Is it possible for Lagos to have a very vibrant health sector whereby we have Nigerians who don't have to travel out for any reason, particularly medical tourism? Can Lagos State have a health sector that can tackle issues like this?
Okay, so the question is around health tourism and being able to tackle pandemic events.
Yes.
I think we've heard several of the panelists speak about health system strengthening and also looking inwards to provide the kind of medical care that Nigerians need so that they don't have to leave the shores of Nigeria to get, internationally benchmark standards of care. This is definitely a priority for Nigerians. We can have centers of excellence across the country. Each of those centers of excellence will be dealing with a particular medical discipline. And we can develop ourselves because, after all, we have many Nigerians in the diaspora that are, at the top of their game in different medical disciplines. So there's no reason why we as government cannot create that environment for us to not only increase our capacity to deliver good health, but also to set up the research base. Because, every country has a different genetic profile, and we deal with diseases in different ways. So what medicine works in the northern hemisphere may not be the ideal medication for people in our environment. We need to really strengthen our research and development platform. Government needs to put a lot more money, not only into health system strengthening, but also into research development and our tertiary academic centers and centers of specialty. But going back to the pandemic, you know, the health of an environment, a country, a state, or whatever, is dependent on the health of the environment. If the environment is sick, then the people will be sick. So we have adopted in Lagos, in collaboration with the Federal Ministry of Health and the Nigerian Center for Disease Control, what we describe as the One Health paradigm. And the One Health paradigm looks at the health of the environment as well as the health of the agricultural base in sync with the health of human beings. So if your environment is sick or the agricultural base is unhealthy, then we as human beings will start getting unwell, whether it's because of, you know, pathogens moving from the environment to human beings or pathogens moving from the animals that we bring into our cities to human beings. This is how pandemics happen. They happen because they jump from the environment into the human population. So we want to adopt a very strong One Health strategy in Lagos in line with what federal government is doing. We have already established a committee in Lagos almost a year or two ago, where we work closely with the Ministry of Agriculture and the Ministry of Environment to try and exchange intelligence between us, because thousands of animals come into Lagos on a daily basis for our food source, vegetables, livestock. Our environment we've had outbreaks caused by abnormal pathogens in our environment. Lassa fever is a good example, cholera, you know, all kinds of drug-resistant bacteria that live in our water table. So if we're going to look at a healthy community, we have to look at all three sectors: the human sector, the environmental sector, and the animal or agricultural base. If government pays attention to all these three in what we call the One Health paradigm, then we're going to have a much more robust capacity, first of all, to prevent these kinds of events, and secondly, to be able to detect it early, and thirdly, with a good health system structure from both primary to secondary to tertiary, with a sound research base, then we'll be able to manage these kinds of threats. So when you're inside a pandemic like this caused by an unknown pathogen, the very important aspect of response is being able to conduct indigenous research to understand how this pathogen is causing sickness in your environment. So we can see that the outbreak is different in different countries. So it's very different. The profile is different in Europe. It's different in Southeast Asia. It's different in Africa. So we can't transpose what's going on in different parts of the world to the Nigeria or to the Africa environment and try and do copycat response strategy. We have to understand our own outbreak. Our scientists, our doctors, our technical experts need to come together, strengthen our systems, research and understand what's going on, and then define an indigenous approach to bringing this outbreak under control, and more importantly, learning from our experiences. We learned from Ebola, and many Nigerians went to Sierra Leone, Liberia, and Guinea and saw what happened there. That's why, to some extent, Nigeria has been a little bit prepared for this outbreak, because we didn't rest. After Ebola, we knew that we were very vulnerable, and we put certain structures in place.
All right.
Thank you.
Thank you very much, Honorable Commissioner of Health, Lagos State. Dr. Mike will have... hello, Dr. Mike, are you there? Dr. Mike Egboh. Okay, like to hear from Dr. Mike Egboh. I was going to ask him about local roots, herbs, remedies, mixtures that can tackle COVID-19. But let me go to the minister now. Honorable Minister, are you with us?
Yes.
Okay. Honorable Minister, the Lagos State Commissioner for Health just talked about the One Health paradigm shift, which will cover environment and agriculture, which plays a key role in human health. Now, how about the federal government? Is this part of, do you have any policy like this on ground, or is it part of the bill that Senator Utazi has been talking about?
Well, I think Utazi will talk about his bill by himself. But the One Health approach is something that has been on the drawing board and is now being operated. It's supported with a $92 million grant by the World Bank and covers certain West African countries. And it's, as the Honorable Commissioner said, to address the idea of One Health from the view of animals and the environment and humans. The connection is very clear in many areas. So the program is running. You see, running is the secretariat is at the Nigeria Center for Disease Control. Part of the money has been extended so far, largely building laboratories and working closely with the Ministry of Agriculture. It's a joint venture between the Ministry of Health and the Ministry of Agriculture.
Okay.
So, that's only remotely connected with what we are doing now with the COVID-19, because COVID-19 is an imported pathogen. We know, of course, the theory of the virus having sprung from the wet market in Wuhan into humans. We have heard that it was probably coming from bats. Other animals have also been mentioned, but a very clear request was made at the last assembly, which finished 15 days ago, that the source of this, the source and the origin of this virus should be investigated. And the WHO World Health Organization is setting up a group of scientists to start studying how this virus appeared and how it got into humans, whether it is a mutation or whether it's actually a virus that has always existed in animals and somehow translated into humans. It's going to be a subject that scientists will tell us about. Meanwhile, we are worrying about how to survive it, how do we take care of ourselves, how do we protect our citizens, how do we take care of those who are already sick, and how do we limit the extent. We are looking at those areas that are particularly vulnerable, because this disease is one of the most easily transmitted diseases ever known. It's extremely contagious. You only need to be in a closed environment with someone who has it for a few hours, and your chances of being infected are very high. And and that's what just for the large volume of infections. And also the fact that only get really sick, relatively speaking. Up to 80% of the people who have low or very mild symptoms are able to transmit the disease to others, and those who have pre-existing problems. What of those things we didn't have yesterday that I can eat? Yeah?
Hello?
Those who have, are you hearing me?
Yes, we can hear you. Please go ahead, sir.
Okay, those who have pre-existing ailments like hypertension, diabetes, there's an interference there.
Yes, this, Honorable Minister, let me just quickly ask you this before we move on. There's a matter here. Recently we spoke with, hello? Hello? Hello?
I'm the Commissioner of Lagos.
Hello? Hello, Honorable Minister.
I can hear you.
Okay, very quickly now, we just want to ask, Nigerians are itching to know the status of the remedy that came from Madagascar. We recently spoke with NAFDAC, and they said they were yet to receive samples from the relevant authorities, I believe from the federal government. Now, what's the situation? How soon can we hear about the efficacy of the organic mixture from Madagascar?
Well, first, we are not yet calling it a remedy.
Okay.
We are calling it a candidate remedy. A
Okay.
candidate remedy is something that is supposed to work until you test it and the efficacy is proven. Because if someone said, yes, I took this medicine and it worked for me, well, it doesn't mean that it's going to work for you. So, yes, we have received the samples, and the president did say that we're not going to dispense it like that without testing it. So we're going to, first of all, send it to our research institutes. As you know, we have a very good research institute here. We have the Nigeria Institute for Medical Research based in Lagos.
Okay.
We have the Nigeria Institute for Pharmaceutical Research and Development based in Abuja. These agencies and any other agency or university that is interested can have samples so they can carry out analysis. First of all, reassure us that it is safe for human consumption. That doesn't take very long. NAFDAC will be involved in that. Secondly, begin to see, yes, is it something familiar? Is it something we have here? Because some persons, some scientists have said, oh, this medicine is actually known here. We already have it here. It's not really that new. And we are familiar with it. Well, those ones will also speak up. And then the things we are going to analyze it to tell us what are the components, what's really inside this medicine, what are the chemicals, what are the compounds that are in it, and what among all of this really works, how does it work, now it's safe, and does it really cure. So those things will be done to be sure that you are going to have something that is going to work, which is what we are all interested in. We are looking for a cure to this medicine.
All right. Thank you, Honorable Minister. Let's quickly hear now from Senator Utazi. Senator, are you there?
Yes, sir.
Yes. Now, Senator, earlier Dr. Mike Egboh, our guest, talked about the delay in approval of funding for the health sector. That this delay sometimes makes it even difficult to implement policies and programs by the government to get things running quickly. Some of this blame goes to the National Assembly. How is the legislative arm of government now reacting to ensure that these delays don't occur again, that monies are approved and things get to start immediately or as soon as possible?
Well, thank you for your question. The legislative arm of government concern itself with receiving budgetary proposals from the executive at the end of the any financial year, and they process it and then get it passed. Once it's passed, it gets to the executive assent, and then they start the distribution of funds through the Ministry of Finance. The legislature has no business with how money is released and how it is done. Our own process is receive the proposal, at the every beginning, every end of the year, and then we'll work on that. But what I want to say is that in emergencies of this nature, we have a service-wide rule where the executive can draw to do anything in an emergency situation. Just like we have public health emergency with this pandemic, there may not be any need to start coming with supplementary estimates in case if it's not covered in the main budget of the year, which is the law of the land. So if you don't have such, the tendency is that you come back for supplementary estimates to the National Assembly for processing and then getting it back to the executive for use. But in the interim, because emergency is an emergency, we expect that the service-wide vote, the executive can draw and give the Ministry of Health to handle the issue as we are having presently. Afterwards, they can come with their supplementary estimate, and we can look at that. So while doing that, they are supposed to put in a legislature on notice we are going to come. A letter is sufficient from the executive that we want to use this money for this issue, this thing. No, it has not been appropriated, but we want to find a way of sorting this issue. God will come back. With their letter written to the President of the Senate and the Speaker of House of Reps, they are informed, they are put on notice of what's going on, and they are supposed to understand that this is an emergency. So once you follow these processes, then the executive can, they are on a group that can go and solve the problems. The issue of health, as a Minister of Health, is something that this has exposed Nigerians to. Why am I saying so? The issue is that we spend most of our money in infrastructural provision, leaving out the main thing that should get all our resources, and that is health and education. In this country, from this experience we have gotten now, we may be coming back after this post-COVID-19, we'll be coming to the realization that we'll be discussing with the executive that most of the money that we spend in terms of providing road infrastructure, provision of transport infrastructure, rail lines and all that, should not be. These are the areas where private sector invest their money and recover their money. They build, operate, and transfer to the government after collecting their money, their investment. We have not seen from federal government to start talking or start putting money on transportation instead of putting rail lines. We shouldn't. All those monies that you go in those areas should be put in health and education. These are the areas that are very, very important for the country. Build very big, good hospitals, research institutes and all that. Provide all the money. We are not doing that yet. Because if you look at the budget of the Ministry of Health and compare it to what the Federal Minister of Works is having, and you will see that also go and to look at education. We are nowhere there. You see all the taking so much chunk of money. This money should not be there. This is the new normal we are going to face after this COVID-19. We are going to look back and come back to the drawing board and look at where our money should be needed most, and that is the health. We need to get it down. Not talking about health tourism. What percentage of Nigerians go for health tourism? The issue is the majority of 99% of other Nigerians that are here. We have to provide for them. We have to look and we have to get the money, get the federal government to hands off every issue where we have alternative source of doing it. You know, the Lagos Benin on its expressway is very, 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 very viable. That if you give it to private sector, they will recoup their money after doing the exercise. All right. The same from Lagos to Ibadan. The same from Abuja to Kaduna to Kano. These areas, these roads should not be given to federal government should have no business in such roads. Giving so much money to Minister of Transportation to talk about rail lines should not be. Private sector should do it. All right, that is what is obtained of a state. All right, look at what happens outside the country. All right, that's what is done. The government concern themselves. Areas where the private sector will not engage themselves in. All right, thank you, Senator. That are not attractive. That's where the government put their money. Forgive me, Senator, for interrupting you. Attractive to private sector. All right. We put the money there. At the end of the day, the citizens suffer. We are going to face this issue. As far as I'm concerned, I am already preparing myself that after this exercise, after this COVID issue, I'm bringing it to a strongly worded motion before the Senate of the Federal Republic to look at this issue so that we will address this issue and turn the trajectory back to what it should be. Both expensive of other clients that have done it well so that we can do it also good for our country. All right, thank you very much, Senator Utazi. I admire your passion about this whole matter. Of course, we look forward to the motion when it comes out. But let's quickly go to our social media platform because we have so many messages that came in, and I believe that these are things that our guests would like to hear, and even Nigerians as well. So we have the first message here from Duru Increase. He says, "Good morning, Radio Nigeria." His call is reaching us from Imo State. He says, "I want to commend NCDC, Ministry of Health, for their selfless service and war against this pandemic disease." Thank you very much.
Ovuna Declan from Enyibichere Alike Nkwo in Ebonyi State says, my take is that the federal and state government should start as of the moment to plan on how the government and her citizens will manage to survive post-COVID-19 pandemic by making sure that they help Nigerians to enroll into large agricultural mechanization and skills acquisition in order to avoid hunger 2021, and that will be the highest virus Nigerians will face. Thank you for being there. Thank you to you too. Omaga Nnamani, also Francis, watching live from Amagunze in Enugu State, says, good morning, my honorable minister and other guests in the studio. Oh, they are not here anyway. They are reaching us via telephone. Says, welcoming the federal government for her committal efforts in containing the spread of the deadly pandemic. I am as well appealing for house-to-house distribution of palliatives to enable every citizen of the country sustain the hardship being caused by the ravaging COVID-19. Again, the Presidential Task Force should make it compulsory for every state to get a testing center. Finally, I want to affirm that it is not yet over until it is over. The citizenry should continue to observe all the precautionary measures. Consequently, the rising nature of the case index. Thank you. God bless Nigeria. Thank you to you too. Brother Ibefo Shadrach AB says, concerning post-COVID-19, I think we need more hospitals. We can't bake cakes without the ingredients. Sure, there will be strange outbreaks in future. Victor Akpabio says, post-COVID-19 era will be tough. Let FG, that is the federal government, state or LG as well, local governments bring in administrators like me, not consumers. So we bring our wealth of experience into bear to boost internally generated revenue, encourage agriculture in rural areas. Okay, I'm sure the government will be very interested in reaching people like you to contribute your quota. Comrade Monday Ame says, I wish to use this medium to commend NCDC, Minister of Health, the Presidential Task Force, Lagos State Government, our doctors, health professionals, volunteers, and frontline workers, I'm sure he includes the media, for their selfless efforts and sacrifice at combating the ravaging effects of COVID-19 pandemic. With the ravaging effects of COVID-19, issue of food security cannot be overemphasized. I wish to use this medium to call on the federal, state, and local government to give farmers incentives, inputs, and bailouts to be able to embark on aggressive farming on a very large scale. Federal and state and local governments going forward should invest heavily on our health sector to be able to meet up with the needs of Nigerians in order to abolish the craze for medical tourism. Chidiebere Nzejeku says, I hope this pandemic will teach our government to look seriously into diversifying our economy so that crude oil will no longer be the major source of income, especially in encouraging industrialization, agriculture, education, and information technology. They should also invest more in health care facilities, both human and infrastructural. Salisu Ahmed Barahaje says, good morning. Yes, I'm watching live from Jos. The government should please consider reopening businesses, schools, and offices with precaution as soon as possible so as to reduce the negative effects of COVID-19 on Nigerians. Stay safe. God bless Nigeria. I'm sure the Minister of Health will have one or two things to speak on the slow hurry to reopen the economy. Betty Arikubaye from Abuja says, since October 2018, my organization has been advocating for more money to be allocated for epidemic preparedness, and we would like to ask, will the 2.5% allocated for public health emergencies out of 5% of emergency care fund from the BHCPF now be made a statutory rather than discretionary allocation? I hope the minister is taking note of some of these issues. Okay, now this should be for Senator Utazi, talking about 2.5% allocation for public health emergencies so that they can react. Mojisola Odeku says, we do not need a new bill. The existing National Health Act should be fully implemented. There is a section there for epidemic preparedness. We should reflect on the section and review it to accommodate current realities, including budgeting and release of funds to implement all related plans. Okay, That will be for Senator Utazi. Sunday, Yang says, I'm really pained that Nigerians wear face masks to avoid being questioned by security agencies rather than for their personal protection. I must commend the Lagos State Commissioner for Health, Professor Abayomi, for his doggedness and selfless service to the motherland. I tag him the most active Nigerian in this COVID-19 period, and he is my man of the year. Good. Emile, Godwin, wow, okay, these are and Moses Aja, Yusuf, these are all viewers who are watching us via the social media handle. Thank you to you so much. We also want to, okay, we will have, I am Chenge Oliver from Makurdi. I wish to thank the Presidential Task Force on COVID-19 and all those involved in the fight. We are watching every effort. However, the federal government efforts in palliative is below expectation, and poverty and hunger on the increase. I am a teacher in a private school, and salary is no more coming, and it's really tough. Oh, what a pity. Olusegun Mike Obasanjo says it is expedient to intensify efficiency to immediately mitigate the spread of the virus and also reduce possibility of escalation. Realistically, what measures are put in place that can effectively address it? Okay, I think that's the number of messages we can take. One more from Oliver Chenge says, until the political class is ready to access the same healthcare centers with the poor Nigerians, our healthcare facilities can't get the desired attention. This is Oliver Chenge all the way from Makurdi. So those are our messages so far. Let's come back to our guests. Let's start with you, Senator Utazi. Hello, Senator. Senator Chukwuka Utazi, are you with us?
Yes, I'm with you.
Okay, yes. Were you listening to our contributions from social media?
Yes, I'm listening.
Yes, there was a question that has to do with allocation, budgetary allocation to the health sector, and that it's still below what it ought to be based on international requirements. Then there was also an issue of the content of the bill you were talking about earlier, that we already have a health bill or a health law on ground that provides for epidemic preparedness. That is it not repetition or necessary duplication of laws to have a fresh bill now? So if you can just round it up, give us a reaction, sir.
Okay. What I will say that the budgetary provision, like I said, that if is expected that executives will introduce a supplementary estimate to take care of this pandemic. Whenever that one comes, the National Assembly will handle it. And we're coming to about the preparedness and against this bill that is before the Senate, the National Health Emergency Bill 2020. There are some provisions here that are very, very important. Like I'll give you one. The section 3, subsection 3, made it very, very clear that the president, after the declaration of a pandemic of this nature, will the Minister of Health to call a committee of experts to look into finding Nigeria's indigenous response to this pandemic, instead of waiting for the World Health Organization and the development partners. Like the Commissioner for Health, Lagos State, there are differences in the national response to this pandemic world over. Nigerian response will never be the same with that of the US. Southeast Asia, from America, from even African, some African countries. We have to develop our own indigenous approach. And this bill has made it sufficiently, have made provision for it, that once the president declares a pandemic, it is also his duty to direct the Minister for Health. We don't wait. The president will direct the Minister for Health to a committee of health experts and scientists to find maybe Nigerian solution to this pandemic. Not just for this one, for any one that will happen in the future. This bill also looked at in section 13 of this bill. It care of the health, they take care of the medication and care of the patient. Once take care of it. Anybody who is who is a patient as a result of this COVID-19, government should take care of everything about it. Because this is not very many people don't even know where this is coming from, and they don't know the nature. So it's only government that can take care of this because it's an emergency area. Government should take care. We have made provision for it in this bill so that government can take care of it for now. Because there's no in any law that we have presently, there is no provision anywhere that share the responsibility between government and the people. There is nothing there. It's huge. So in this bill, we have put it in there. We know that there is so many conspiracy theories out there, you know, about the Bill Gates and all that, about the French doctors that say they're going to use Africans as their guinea pigs for the test of their drugs.
Okay. All right. Thank you, Senator. Let me quickly go to Lagos State, where Professor Abayomi, we just want to get a reaction from you as well. Hello, Professor. Hello, Professor Abayomi.
Yes, thank you.
Okay.
I'm here.
Now, I just want to.
I'm not supposed to all everybody, all the panelists are.
Hello. Hello. Are you? Hello, Professor. Are you with us? Dr. Mike Egboh. Hello.
Yeah.
Hello, Dr. Mike. Are you still with us?
Yes, I'm with you.
Okay, Dr. Mike, please hold on for just 30 seconds. Let the Professor Commissioner of Health from Lagos State just react to something, then we'll come back to you in just a few seconds, sir. Professor.
We've already won a game and we're celebrating. We're looking at it.
Professor, are you? Hello, Professor, are you on the line?
You currently do not have sufficient.
Professor, okay. Professor, while we do that, let's take one or two calls of people who are on the line. Then we'll come back to our guest. Hello? Hello?
Yeah, good morning.
Yes, good morning. Please quickly tell us who you are. Go straight to the point. You have about 40 seconds and your location.
Okay, Chief Fidel Onyeneke, and I'm calling from Owerri in Imo State.
Okay, go ahead.
For us to get it right, let's go back to basics, and that is by strengthening the health departments of various local government areas. Let them embark on inspection of toilets, so many facilities in the rural areas. There is need for public health education, massive public enlightenment, and above all, sanitary inspectors should be engaged to carry out their duties. And in doing this, we must make sure that all primary and secondary institutions study health, education, and hygiene as a compulsory subject, while the public institutes of technology, health technology are equipped so that they will train out professionals who will embark on environmental duties. Thank you and God bless you. I'm Fidel Onyeneke.
All right, thank you very much, Fidel Onyeneke. Hello, good morning. Tell us who you are and your location, please, and go ahead. Hello? We have a next caller. Your name and location, then go ahead, please.
I am Mr. Ola Kelani calling from Kudo.
Oh, Mr. Ola Kelani. Yes, sir.
Yes.
Ekarosa, go ahead, sir.
Yes, this is Radio Link. Yes.
Okay, sir. I need the number. The number. Okay.
Well, thank you so much, Mr. Olakelani. Hello. Hello, good morning. Your name and location, please. Okay. All right. We're still trying to establish a reconnection with some of our guests. Okay. Let's take this caller. Hello, good morning. Hello, yes, please. Tell us who you are and your location. Oh, good morning, sir. Okay.
Hello, sir.
Yes.
Yes, we went on, and then we were going to come, we're going to connect you back in a few seconds, sir.
Okay.
Yes, just hold on. We'll call you back later. Wait.
Yes. 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 Thank you very much. This is Lagbe Ibrahim. Let's see if we can take a few more calls, then we'll go back to our guests. Hello, tell us who you are, your location, please. Yes, good morning, sir.
My name is Nomade Benam Here's calling from my paradise. Eziachi in Olu. Nigeria. There is confusion everywhere in Nigeria. I want to thank God for this pandemic because without it, we have taken ourselves, we're taking now. So I want our country, Nigeria, and the leaders to reschedule our priorities. I want our country, Nigeria, to know that after today, there will be tomorrow. Our schools should be equipped. They make sure that the running water is equipped in our schools, put in our schools. So children will not suffer when they go back to schools. Finally, I want all the state governors, like in Imo State, the governor hoping to do more is doing well. As long as this issue goes there. But I want him to do more. I want him to make sure that everybody is carried along. Thank you. God bless you.
Thank you very much. Nnamdi from Olu, thank you so much. Yes, we'll still take more calls. We'll still, because we have enough time, we want our guests to close as they react to all the issues raised by Nigerians. Hello, your location and name, please. Hello, hello, are you there?
Good morning.
Yes, good morning. Tell us who you are,
Yeah,
where you're
this is
calling from.
Pastor Uzoma Ernest. I'm calling from Imo State. Yeah, you see, talking about the post-coronavirus lessons, Nigerians must have learned how to get ready to such sweeping terminal diseases like coronavirus and not the fire brigade approach we are known with. We must have learned that God cannot be ignored or abandoned, and he has the solution to all life problems and not science and technology. Also, listening to
Ministers of God during such incidents is a great gain to government and the people. Nigerians must have learned that poverty, hunger, and hardship are more endemic state. Must have learned that telling the poor masses the truth pays than paying lip service or bill service to a critical matter like coronavirus. Nigeria shall wax stronger than before.
All right. Thank you very much, and we say a big amen to that prayer. Yes, now let's come back to our guests. Hello, are we all there? Dr. Akin, our Honorable Minister, Dr. Egboh, and Senator Chukwuka. Are you okay? Now, we apologize for that, but let's start with you, Honorable Minister. Hello, Honorable Minister, are you there? Hello. Okay. Hello, Honorable Minister. Okay, let's just hear from Professor Abayomi. Are you there as well?
Yes, I'm here.
Okay, good. Now there is a matter that was you've got quite a number of commendations from our social media handles, but some Nigerians are asking. Recently, we had on the social media news angle that the state government, as Lagos state government, is considering for some people to treat themselves from home using advice from professionals and experts engaged by the state government. How true is this, and how feasible is it?
Okay, I think I heard the question as Lagos is trying to adopt home-based care.
Exactly, that's it.
If that's what I heard.
Yes, that's it. Go ahead, please.
Yes. So our outbreak is expanding in Lagos State. We have active community transmission. We are exceeding our capacity to manage people in our isolation centers. It doesn't matter how many isolation centers we build, the number of cases we diagnose per day is increasing. So we are stratifying our patients now. We want to integrate the management of patients both in our isolation centers and in the community at the primary healthcare level. So we will keep patients who are unwell. We will dedicate our isolation facilities for those that are struggling with COVID, so we can give them more care, while we confine those with a very mild illness to what we call community or home-based care. It's a recommendation of the WHO. It's being practiced around the world. Once the outbreak exceeds the carrying capacity of the health infrastructure, then you have to develop a new strategy where you manage people at the community level. So we're in the process of transitioning to an integrated process where we manage some people at home in the community and we manage the more severe cases in our our isolation facilities where we have more sophisticated medical personnel and equipment to look after communication. So I wanted to go back to a comment that you asked me.
We're talking to him, wasn't
When you look at
okay. Hello, Professor, Honorable Minister, are you there? Dr. Osagie Ehanire, Honorable Minister, Health, are you online with us? Are you still with us? Honorable Minister, can you hear us? Okay. We're still having troubles establishing connectivity with the Honorable Minister of Health. We want him to react to some of the issues that have been raised so far, even by our contributors on the program as well. Maybe we'll still keep trying. Hello? Hello, is it trying to get... Hello? Can you hear me, sir? Honorable Minister. Health. Hello? Dr. Osagie. Okay. Now, let me come back to you, Dr. Mike Egboh, all the way from the US. Dr. Mike. Hello, Dr. Mike. Are you still on the line? Hello, Dr. Mike Egboh. Hello, Dr. Mike. Hello. Okay. We seem to be having a challenge with connectivity with our guests, but let's keep trying. We'll still continue with the conversation. We don't have much time, so whenever we establish ties with them, it will just be for them to give us a final advice on this platform. For today, let's take one or two more calls while we ensure that our guests are with us. Hello. Hello, tell us who you are and where you're coming from. Yes, we're fine. Please go ahead.
Yeah, I'm calling from Olo.
Jonathan.
For our healthcare delivery system to be overhauled. Even the embarrassment we suffered as a nation caused by this coronavirus, in spite of the trillions of petrodollars over the decades attributable to Nigeria. Whoever told us that the day would come when both the leaders and the led, the affluent and the lonely, the rich and poor would not be allowed to travel abroad as a result of the global lockdown occasioned by the for medical treatment. The lesson herein is that our political leaders must ensure that now henceforth our healthcare delivery system is adequately catered for and made functional and ready for unforeseeable exigencies and such emergency and situations as are presently rising now. We don't need a fear of prophet to tell us to look inward and put measures in place for the containment of emergency situations like this. Be prepared at all times is the word. The outbreak of coronavirus exposed the underbelly of our health system and the neglect it has been subjected to over the decades. Then lastly, I want to say here that we equally have seen the need for constant power supply.
All right, thank you. Let's come to the Honorable Minister now. Honorable Minister.
Hear me now?
Oh, yes, we can hear you, please.
I could hear you clearly before.
Yes, we apologize for that. Please, just tell us now, we want a reaction to some of the, I don't know if you're able to get some of them, but some bordered on legislation. Again, once again, some talked about legislation on research, on finding remedies and so on to issues like this. So please go ahead.
Well, the first thing I want to say is respond to the two Senator Utazi committee. Therefore, you have to set up the internet that committee that is working.
Yes, we can hear you. Go ahead, sir.
And the committee is long since operational. It's chaired by Professor Somori and has a lot of eminent professors in there, Professor Ehanire, Professor Chukwuka, Professor Utazi, and Professor Bakare, Professor Radindadi, Professor Habib. So it's a 17-man team that has been working advising the ministry. So when he says that Professor Bolahari says that there is no committee like that, then it's just Habib follows. So the committee is already working and doing a lot of the activities that are involved. Now, for the remedies, the each team is a remedy. A lot of remedies are being tried. We are involved with the World Health Organization Solidarity Trial, which is looking at the efficacy of certain remedies that have been tried somewhere. Chloroquine, hydroxychloroquine, azithromycin, and remdesivir. So those are the things which are being tried and attempted to see if they really have worked. But there are also head of medicine who say that they have the skills. They have referred many of them to the Nigeria Institute for Pharmaceutical Research. We spoke just now about the herbs that came from Madagascar. So we are leaving no leave unturned. We are looking at every possibility that we can before us because this is a new virus. It's not been known for anything as we respond. And the behavior is not very clear. What takes care of it, we don't know. All we know is that it spreads extremely easily, it replicates very, very rapidly, and can affect almost anybody and has the greatest toll on people who already have pre-existing illness, who have hypertension, diabetes, kidney problems, cancer,
HIV, TB, then those are people who are really the main victims, and also elderly people over the age of 60. So, and a lot of people also have low symptoms if they have had it. So that's what we know about the disease so far.
Okay. All right, thank you.
Any other question I missed out?
Okay. Honorable Minister, let's just quickly hear a final word from other guests on the program. Then we might come back to you if we have more time. Dr. Abayomi, just a final word in 30 seconds.
Thank you.
Yes.
I was saying, one of the ways to strengthen Nigeria against this kind of scenario is to spend more money on research and development. So our quaternary institutes like the Nigerian Institute of Medical Research is severely underfunded. When you compare how much money America, South Africa, Europe spend on R&D, it's almost 100 to 1,000 fold more than we are spending. So as government, we need to look and strengthen these institutions.
All right, thank you.
We depend on external funding for a lot of the research we do, whereas I think we should be using indigenous funding, empower these institutions so that they can help us not only develop our own indigenous strategies, but also during an environment like this where we are hit by biosecurity threats, that they will be in the best position to help us find those indigenous solutions. So more funding needs to go into our tertiary and our quaternary medical and science research institutes.
Thank you, Professor.
So I think I'll stop there.
Okay, thank you. We still have
I can respond to that. Yes, I agree with the professor very well, but the problem is that the funding is limited. There is no way we can fund the way America funds. If you look at American GDP and look at Nigerian GDP, you can't compare the two. You look at their national income and their national income. We can't. The country of 200 million people has a lot of challenges, health system, education, infrastructure, industrialization, electricity. So why we really do campaign for more funding for the health sector?
All right, thank you, Honorable Minister. There definitely will be more opportunities because we're still going to continue from where we stop next week. Let's hear from Dr. Mike Egboh. You have just 20 seconds, Dr. Mike. I'm sure you have something to add.
Okay, I want to thank everybody. Thank the Honorable Minister and the Commissioner for being our support, and I will also like to thank Dr. Nicholas because, just recommendation. Number one, we need to look inward and do things that is good in Nigeria. We need to ensure manufacturing of generic drugs in Nigeria.
All right, thank you. Let's just hold it there. We still have next week. Senator Chukwuka, are you there? Just 20 seconds too. Yes, please. Go ahead. You just have 10 seconds. Final word.
Okay, well, you see, first of all, I didn't. The minister was talking about committee. I am saying something of the provision in the bill that is before the national assembly. That is part of it. Is a part of it that at any point in time, the president can call the minister to do that. That's what I said.
All right, thank you.
I'm telling Nigerians, let us work hard, believe in ourselves, and work hard to give us the direction to go.
All right, thank you very much, Senator, for being on the program. We wish to thank all our guests in person of Senator Chukwuka Utazi from the Senate, also the Honorable Commissioner for Health, Lagos State, Professor Abayomi, Dr. Mike Egboh from the United States, and of course, the Honorable Minister of Health, Dr. Osagie Ehanire, for making today's program an interesting one. Don't forget to join us next week. We'll still discuss and continue from where we stopped. I wish to thank the studio manager, Krista Paraucha, and Rosemary Ungu. Engineers was Joseph and Daniel Oladele. IT department was handled by Jonathan Aino and Dana Haruna. Online editor was Timothy Bamidele. News producer Aziza Tusani. Assistant producer Idara Upayan. Producer Olufemi Fulani. And the executive producer Sani Suleiman. I am Olayemi Daniel. Join us next week as we continue to make our country a better place and a safer place for us all. Goodbye.